open to a session, then close to a session. What's that? Sure. I can do that. Okay.
At least for families here. 2018. Back to 2017, so that's about 6% back the year before that. From 1,300 to 800.
Welcome to our Investment and Benefit Committee for the first quarter. We are discussing benefits this time. We had our investment meeting, it's been a couple weeks ago. We're going to go through our agenda. First, we'd like to welcome Gallagher. They're our new benefit broker. We'll allow them some time to do introductions, and we'll do introductions so they all know who we are as well. Go ahead.
I'm full of background noise. Okay.
YouTube channel.
About to say I'm full of it, but that wouldn't be very good. I am Sterling Oaks. I'm the Area Senior Vice President for Gallagher, and I'm one of the consultants for the Utah County account.
Chad Carlson, I'm the benefits analyst for Gallagher, panel members.
That's for this year.
And I'm Leah Dunn. I am the Senior Client Manager for Gallagher.
Welcome. Thank you for being here. For Utah County, I'm Cammie Taylor. I work in Human Resources.
Dave Shawcroft, Utah County Attorney's Office.
Kim Jackson, the Treasurer's Office.
Ralph Clegg with the Health Department.
And we'll excuse Sheriff Jim Tracy. First item of discussion is a placeholder, really. As we explore this year changing from vacation and sick time to having a PTO program, it's something that we'll discuss openly, and we'll discuss where our liabilities are and what we think makes sense to recommend to the commission. We don't have anything to discuss today, but that's a placeholder. We'll turn the time over to Gallagher to get into our 2018 first quarter share numbers.
All right. So when we look at 2018, we are looking, actually we're going to start by looking back on 2017. The SHARE program has many different areas and components on why you were to receive a 4% increase with Select Health And that was due to participating in wellness and meeting all of the challenges. And what we have on screen is how the 2017 year ended. And so when we look at Utah County meeting the metrics of what was required for that 4%, you did it. And the good news is, as we look at statistics to give kind of a watermark and benchmark for where we're at in 2018, 2017, the subscribers that created a My Health account, there were 96% of employees that created that account online. Those that contribute to a health savings account, 100%, and that's the county makes a generous contribution towards the health savings account. Subscribers that have completed an online health assessment, we ended at 76%. Subscribers that completed 2 activity campaigns were 65%.
So Sterling, did we not meet our obligation on that, or we did because it was 60%?
You did, yeah, you did meet the obligation. So you made it above on each of these categories, some of them more than others, so the 60% was enough. Subscribers that have completed digital health coaching, 74, where that one was a 70% requirement. Subscriber attendance at health education screening events, 79%, so good participation there. 70 was the requirement. Subscribers that have completed disease management program, 80%. So we met the requirement there as well. And those that selected a primary care physician was 80% as well, a key component to value-based medicine and having the SHARE program as an accountable care organization. Subscribers completing the recommended preventive care, there were 82%. So we always like to see these numbers as high as possible, but you've done what is required in order to get the 4% increase for the 2018 plan year. So that is a backdrop, and as we look at where we are at for the 2018, the first 2 months in 2018 up to the current date, we're going to pull up on screen where we're at now. 2018 would be the second attachment of that email, which will be on screen for those of you up top.
So while he's pulling that up, is it 70% the minimum participation rate the current year then?
Correct.
Is there any way to make that a little bit bigger? Maybe if it's not in full screen and then, yeah, make it
That's
a little
better.
bit bigger.
So these are obviously very early in the year. We have time to continue to improve upon these numbers, but this will be a continual emphasis for the program. So subscribers that have created a My Health account, that went down slightly by 2% to 94%, so certainly a bit of turnover there. And then we have subscribers that contribute to a health savings account, 99%, so probably some new hires within the wait period, or that 1% is. And then we have subscribers that have completed an online health assessment. We're at 41%. Last year at the end we were 76%. Some of these start over again. And so you'll get credit for those that have continued onward with the health assessment. And we'll
Which
want
one
continue
has to
on.
be done within 90 days?
We need to have the health assessment. That one we need to have a push on.
Yeah.
So
So we have to get 70% within the next, before the end of the month?
right,
So let us make a plea to everyone to please do your
online health
Assessments.
assessments. Mhm.
Better get an email out too.
Didn't by going downstairs, didn't that count for the health assessment? You have to do an online one as well.
That's a
Yeah.
separate item there. Is the,
Bunch of questions you have to answer.
Correct.
Man,
You just need to send the link out to everyone.
To get it, yeah. Then we have the next one is subscribers that have completed 2 activity campaigns, 7% of the population. Now these are they're mini activity campaigns that you probably have been receiving as an employee via email. There's step challenges, and there've only been a couple of them, so 7% have participated throughout the whole year. We need to certainly have that percentage higher than the 70%, so.
Actually, I think there's only been one, and the second one just started this week, so I'm not sure how we could even have 7%.
7%.
Because you're
You can
allowed
have
to do
personal ones, too.
steps. You're allowed to do 20,000 in a month in
Oh,
30
okay.
days.
20,000 will count as 2.
Correct. So if you did it
Challenges.
2 months in a row, you've done 2 activity campaigns. So yay for those steppers.
High steppers. Subscribers that completed the digital health coaching, 32%. At the end of the year last year, we were at 74. So we'll continue that trend. Subscriber attendance at health education screening events, 64%. And at the end of last year, it was 79%, certainly through the activities throughout the year and the open enrollment timeframe. Would be something we would.
Is there a deadline for
Continue.
that one too?
That one, I believe, is at the end of the year. I can confirm
I
that.
thought that was the deadline.
It is the health education screening events. We haven't had ours formally yet for this
have
year. You
in
did
January.
for all of the whole year? Okay, so I'm gonna look into that then and see.
That would be not an easy one to get the numbers up. They'd have to move quickly.
If we're at 64, we need a little bit higher
But
than.
there's a deadline.
Well,
Yeah.
and
I
I
think it
think,
is.
I don't know that we've reported it. When I looked, I got the spreadsheet from Carrie and I looked through it and I know people that went to it that they weren't filled in. So I think she's still updating that.
Oh, so our actual number may be higher,
Yeah.
maybe okay.
So we could shore that up then to get to
Yeah.
the 70.
But we ought to figure it out this week, or next week.
All right. So that's an action item. Subscribers that have selected a primary care physician, 75%. Ideally, we'd like to have everyone in the population have a primary care physician, for that's the reason why SHARE program works effectively, to lower the cost of care. And certainly if you go to the emergency room and the emergency room is your primary care physician, then it's not working very well. So the idea is select your primary care physician, and in the event that you have something that happens, you'll talk to your primary care physician and they'll coordinate the care. Because there's a shortage of physicians out there, and there's a lineup to be able to get into a primary care physician if you're a new patient. So it's always, let's get in and make sure that you do have a primary care physician. I'm talking nationally as general trends, and that's why value-based medicine works better generally than fee-for-service.
Well, in this one requirement, it's literally just going into Select Health and a drop down in your activity or your,
My health.
My Health, and selecting someone, just selecting anyone really. You don't necessarily have to go to them to get your exams. If
It'll
you're going
count for
out
the
of-
credit.
But if you're going out of network, I mean, you're not gonna be able to select someone, but if you select someone, then
Correct. And then lastly, the subscribers complete recommended preventive care or cancer screening, 78%. It's dipped down slightly from 82 at the end of the year. So that's where we're at the beginning of the year. Certainly some action items that we'll want to focus on. Then we did have another, I'm going to state a few items that we noticed just from some data, and just to see how well the SHARE program is working in terms of members finding providers inside the network versus outside the network. In terms of practitioner payments for all of 2017, seeing providers, 96.69% of all payments were considered in-network, 3.31% were outside of the network. Facility payments in a hospital, 96.9% went to facilities that were in-network, 3% were outside of the network, bringing a combined total of 96.83% of employees going to in-network providers for care, and 3.17% out of network. So the reason we bring that up is because when we look at the number of providers in the SHARE panel, I went to a meeting recently and they stated there were 5,100 providers in the SHARE network. And they have enhanced continually each year the panel to ensure that members are continually receiving more and more provider options.
Sterling, can I ask you a couple questions on the previous sheet?
Sure.
One that's showing up here.
Mhm.
Down on the 2017 Utah County Share Plan at the bottom, it has their deductibles and employer HSA match. 2017, it says the deductible for a family is $8,000. I believe that's $6,000. And it says that the employer puts in $3,200. I think the employer only puts in $1,600. And that would be the same for the 2018, unless I'm incorrect.
No, you're correct.
Correct. So this is, certainly we could, we'll get some information. This is what Select Health's official has, but I think that, you know, what's in your contract is correct. So this is just a different reporting system. So we'll ensure that that is correct on these reports in the future.
I also believe that the premiums
Is wrong.
listed above that are high. I think
Seem to be wrong.
our family plan premium is like $20,000 for a year, which would be under $2,000 a month. So again, I could be wrong, but I think it's somewhere in that.
It's like 1,400. And some change. So for our next meeting, we'll draw up the
Sure.
right side so that we have the correct numbers that we're looking at. Okay, our next item is future scheduling. You feel like waiting until second quarter is sufficient? There aren't any pressing items.
Unless there's a need to meet, to make some decisions right before the, you know, the benefits fair or something.
Mhm.
Okay, so what does everyone look like in June?
Days of the week do we prefer?
We've been doing them on Mondays.
That's fine. Look to the 18th or the 11th.
It's the 11th.
We're doing it in June, what about the 4th? I think earlier in the month,
Okay.
when people are gone. It's to be busy later, but I would suggest the 4th if you like.
About the 4th at 3:30,
Sure.
work for
Does
everyone?
that work for you all?
Will you guys send out the invite?
Sure.
Okay, and then our last item, I move that we approve and set a date, time, and location for a closed meeting to discuss the character, professional competence, or physical or mental health of an individual or individuals suggested for today's date at this location following the completion of our regular agenda.
Second?
Motion and a second. All those in favor say aye.
Aye.
All right,
Okay, we'll go ahead and move into our closed session, and then we'll